Good morning and welcome to this press conference. Ukrainian doctors exhibit photos about the healthcare system during the Russian-Ukrainian war. My name is Thomas Ash and I am a documentary filmmaker and member of this club. As I am sure many of my esteemed colleagues who are journalists, filmmakers, and photographers can attest to, meeting resistance, making people angry, and having complaints lodged against you is often a sign you are doing something right. And so I would encourage today's presenters to take the fact that there has already been a complaint about some of the photos in their exhibition as a compliment. Images of war do indeed make us feel uncomfortable, so much so that we want to look away. But that is exactly why we must see them. They show us war is a terrible tragedy in which many innocent lives are lost. Closing our eyes would not end war. It would only make us complicit in it. I am grateful to today's guests and all of the doctors and medical professionals who have captured these photos for giving us the opportunity to see part of the reality of the war in Ukraine. And I am grateful to the FCCJ for providing this opportunity to share this reality with our members and their guests. Tetiana Yatsenko, senior researcher of Palladin Institute of Biochemistry of NAS Ukraine, and Oleksandra Riabets, medical student at Bogomolets Medical University in Kyiv, are here with us today to talk about their photo exhibition. Thank you.
Thank you, Mr. Ash. We are grateful for the opportunity to present this photo here at FCCJ, and we're also grateful for support to FCCJ and to Juntendo University in organization of this photo exhibition and this press conference. With the exhibition, we wanted to show the reality in which Ukraine lives last year, but actually Ukraine lives with this reality 9 years. And we understand that if we and you just close our eyes, war doesn't stop. And we cannot avoid this reality because actually all the world lives with this, not only Ukraine. And also we wanted to show that we wanted to say that war is a man-made disaster and which lasts long and takes resources, but this disaster is the intention to destroy, control, and kill. And with this exhibition, we wanted to maybe change the attitude of people, because all the time we hear that people are sorry because of war in Ukraine. But people who fight now, they deserve not only sorrow, they deserve respect because they do so much, not only for their own lives, but also for other people. And now Ukraine is a frontier of this war. So we wanted to show how Ukrainian medical system fights now against the difficulties made by Russian army in Ukraine. But also we wanted to say that medical system is not unmanned machine. It has thousands of faces of doctors, nurses, healthcare managers, volunteers, and patients. And all of them do their part of work. And all of them fight for their lives and health and future. This is a chat with my sister. She is an ICU doctor in one of Kyiv hospitals. And 1 week before the 1-year mark of full-scale invasion, when everyone was afraid that Russia will strike again to Kyiv, I asked her how is she doing and what she said me. Yesterday I was in a taxi and taxi driver asked me if I plan to leave Ukraine if the Russian troops attack Kyiv again. And you know, I didn't ask myself such questions before, but no, I won't leave Kyiv. I'm going to fill up my car and go to work at the hospital. Doctors have an easy choice. We choose to work where we are most needed. But you know, last year was more scary and difficult. And now we already know what to expect. And we have Korean muscle relaxants and Japanese propofol, so we can manage this. She was ready, and she is ready. She's ready to fight for her life, for her patients, for their lives, their health, and future. And this is a map of Ukraine yesterday, I think, or 2 days before. The length of front line is more than 1,000 kilometers, and the front line is heavily bombed not every day, every hour, or even every 10 minutes. But not only frontline cities are struggling with this problem. Russians hit also other cities several hundred kilometers from the front line. And they target everything: civilian infrastructure, living blocks, and medical system.
Ukrainian medical infrastructure is the target of Russian army. As for February 12, 2023, Ministry of Health of Ukraine stated that it is more than 1,200 medical facilities have been damaged, and more than 170 facilities have been completely destroyed, which means that the building is destroyed more than 90%, so it cannot be renovated. It should be built from the beginning. And also, 540 hospitals were damaged. That means this is 9% of hospitals of Ukraine were damaged and couldn't provide effective medical care to the patients. Here you can see the surveillance system for the healthcare, and more than 800 of attacks were performed on Ukraine, stated for the March 10th. And you can see that the main cause is heavy weapons, but also it includes individual weapons and removing of medical staff. And the fact that many hospitals were targeted repeatedly indicates that these assaults were deliberate. So the Russian soldiers definitely knew that this is medical facility that they are targeting, and that this is doctors and patients who are inside. And here you can see the ambulance that was shot precisely, and it's not the accident, it's not the long-term missile, it's gunshot. So it was obviously that this is ambulance. This is obvious that there is a doctor inside and a patient inside. And as for now, it is stated that more than 400 ambulances were damaged or stolen by Russian soldiers. Taking into account the circumstances that the doctors have to work, massive shellings, and shortage of resources, it makes it obvious that the first point that they consider every day is the protection of their own life, protection of patients' life, and doing everything that can minimize the risk of being injured from the bombs and mines. So the best option to save patients and staff is the basement. But not all hospitals have the shelters that are equipped enough to provide efficient medical care. So it means that it was just a basement that was reorganized, beds were moved there, and all medical equipment, and people could spend weeks and even months in those basements. And the basement became the place of birth, of taking care of wounds, blood transfusions, dialysis, all those manipulations that normally can't happen in those conditions and those places. But sometimes it's impossible to use a hospital or any medical facility as a shelter, so to say. So it will, for example, in this picture, you can see it is a hotel basement in Hostomel, and you can see that the walls were removed and that IV bags are fixed by pipes to the ceiling, so the doctors use this room for everything that they needed as bedroom, dining room, and stabilization point. If there is no basement in the hospital, the next option is the two walls rule. So you will move your patients and staff to the room where there is no windows and at least two walls from outside. So that would prevent from injuries from glass and debris. But sometimes some patients and equipment can't be moved from their original place. That speaks for operating rooms and ICU. So in that case, the only thing we can do is cover the windows with plywood, cardboard, metal, a tape, a sandbanks, everything that you can have. It doesn't mean that it would protect from the missile, but at least it can minimize the damage from sharp glass and debris. As well, if the hospital is shooted precisely, that would cover the shadow of a doctor or any person who is inside. Talking about the doctors at the front line, they even at the high risk. So they often use camouflage, body armor, metal vests to protect themselves. And for doctors, every air raid siren, every shelling means that there are damaged and dead people. And sometimes massive admission is so huge that there is no time, no staff, and no reason to, and actually patients are unconscious and unknown, so you can't really write their data. So doctors use the numbers to write it, and also they wrote all the data on the patient's body. Here, while preparing panels for our exhibition, we wanted to include the most specific description that we can from the author of the exhibition. So we wanted them to remember all their feelings and thoughts on the day. And here we suggest you to listen to the interview of Dr. Olena Nesterenko, who provided photos for our exhibition.
Unknown number one. During the piece, the term unknown we use when the hospitalized patient was without any documents or some marks that can detailize their person being, or without any relatives that can give you some information about the patient. So it's a kind of our routine that we use, but we quite, it's not so usual for the children, because children always arrive with their parents. So here, during the first days of war, when we have a lot of patients without the documents or without their relatives who can give us some information, we have a lot of unknown patients. And this one, in a photo, you can see their leg of small child was the first one.
Do you need a break?
Yeah, few seconds, please.
All of the photos were taken by doctors or other medical professionals, basically on their phone camera. And even though doctors cope with death and hope every day, it means that this moment prompted them to take off their camera and capture this moment. Because, for example, on this photo, it shows the boy. The boy and his family were shot in the car, and then, unfortunately, the boy was delivered dead to the hospital. And due to the air raid siren and no time and no people to move body to the pathological department, the body of the boy was laid in the ambulance garage and covered with a piece of slate. And that is something that never happened in the city hospital. Another, except for directly targeting the hospitals, when there is a damage caused to the energy infrastructure, it also means a lot of consequences to the medical facilities. Since October 2022, Russian targets energy infrastructures And this leads to long blackouts in all regions of Ukraine. And sometimes even the hospital have autonomous power generators. Due to the jump in voltage, the battery of the devices is destroyed, though that means that there are only hands of a doctor who can pump air in the lungs of a preterm babies in the basement of the hospital. Another challenge that face doctors of Ukraine every day is the huge number of people who are injured, who have heavily injuries caused by the shrapnel, flechette, and cluster munition, which cause multiple damages, heavy bleeding, and bone fragmentation. And more than 12,000 adults and children have those heavy wounds, and almost all of them require prosthetic limbs and long rehabilitation, which means that Ukraine has to develop new methods and programs of rehabilitation as well as train new medical professionals.
People who lost their health or their limbs, like on this picture, they also often lost everything they had. They lost their families, they lost their beloved ones, and that means that in many cases they lose the willing to live and the feeling of value of their lives. And doctors, they need not only to treat the body of patient. In many cases, doctors need to treat soul of patient and support their patients all the time.
I don't want that the people take the war to the home, but I want that they can take their kind of power from the Ukrainians and see that in each difficult situation, you can find their not the answers, but the way how to manage them, the situation when you can imagine the situation that really hurt you. So also, I want that the people have to understand that their peace is a really fragile thing. So, and we have to work for keeping the peace. But when the war is happening in your country, you have to fight for your being, for the right to exist.
Thank you. I would like to extend our gratitude to all the doctors and medical professionals who shared this work with us, and also to the people in the photos, because I understand that you have their permission as well to share these images. And so we're very grateful to be given this opportunity to see this terrible truth. I would now like to open the floor for questions. I think I'll start with a question that we received online, which speaks to the point that you just talked about treating the soul of the patient. This question is from Eiichiro Tokumoto, a writer and a regular member here at the club. The history of wars in the past is the history of post-traumatic stress disorder of soldiers. We can find a number of cases, such as the Vietnam War and the Russian War in Afghanistan, that has benefited countless veterans, their families, and friends. Do you think that the medical system in Ukraine is ready to deal with the PTSD problem of soldiers? Also, ordinary Ukrainian citizens Are they suffering from PTSD as well, from the shell shock attacks, and how can you deal with that?
The war in Ukraine is the biggest war in Europe since World War II, and maybe one of the biggest wars in the world since World War II. And I don't know if there is a country in the world which is ready to deal with this number of traumatized people. Ukraine was not prepared to this huge war, and I think no one is prepared. So, but we don't have choice. We need to develop these programs and systems to take care about people who need this care. And PTSD is not only the problem of soldiers. And I think we should mention that most of Ukrainian soldiers now are not military people. They are not military professionals. Like my father, he's a farmer, or my brother, he's lab manager. They are not soldiers and never had this experience before. But also, PTSD is a problem of civilians, of tens of thousands of civilians who live in cities near the front line, or even not the front line, from the occupied territories. Of course, this is a problem, and Ukraine needs to think about how to solve this. Yeah.
And actually, Ukraine is already thinking about it, because now they're developing the new packages of medical service that includes rehabilitation, and that is included in programs of medical guarantees, which means that would be provided free of charge for all the population. But now they're just working on it, because we already have a lot of people who need that rehabilitation, but we can only imagine how many more it is going to include.
Are there any questions from the floor? Here, please.
Peter Line with Forbes magazine. Thank you very much for the presentation. It's very, I'm not really sure how to explain it. It's a very, very shocking, very real presentation that we all need to think a lot more about. We have the luxury of living in peace, and just to hear your words really brings it home very, very strongly. Thank you for that. I just wanted to, you've showed us some of the conditions that the doctors, nurses and staff have to work under. Can you give us some more idea about what type of conditions the medical staff have to work under? Because I've heard stories that you're not allowed to, you cannot use helicopters to move, for example, organs or things like that. Ambulances need to be treated in a certain way. Hospitals need to be treated in a certain way, like you need to barricade the glass, the windows, for example. Can you give us some more details about the conditions, helicopters, transport, how you actually work with the medical industry and the medical staff in Ukraine? Thank you.
Yeah, well, we can't use helicopters for evacuation, especially near the frontline cities, because that means they would be definitely targeted and fallen. But in case of on-road vehicles, there's pretty the same thing. And normally we don't use that much ambulances because they're pretty expensive to buy, and at some point they became disposables, because if the vehicle survives 2 missions, that's a lucky thing, because mostly they would be shotted, as you could see on the pictures, and we hope that people who were inside will survive, so that would be just a vehicle that was damaged, but almost always, that means that people inside didn't get to the stabilization point. So we often use other vehicles like Mitsubishi L200. So this is a pickup that is covered from outside with nets, camouflage nets, so that it wouldn't be so seen, and inside it is transformed to have one patient and a doctor, so the doctor can provide emergency medical care while they are driving. And the point is to get the person to the stabilization point as fast as possible, because every life needs a time, and then they provide help according to March protocol and damage control protocol, which mean that the doctors should be trained enough to do all examination and decision on the amount of medical care that would be provided to this person on this level of medical help, and then to decide how to move it further for further treatment, for more specialized care, and then to the safe place to heal and to get rehabilitated.
About windows. On this photo, you can see the preterm baby in children's hospital, and on the background, you can see sandbags. Sandbags in the window to protect this child, because preterm babies are really difficult to treat, and they need special devices. And usually it's impossible to move them into basements, for example, and it's not safe for them because they need temperature control, infections control. So it is every time it's a matter of risks being killed in the ward or in basement by infections, for example. But in frontline cities, sandbags in windows just must have picture of every hospital, because this is the only way to protect people inside from wrecks, from sharp glass, from flashets or bullets.
So I would like to offer some context about the exhibition for people that are watching from home. So this is, there's a physical exhibition here in the press club, which we can maybe talk about in a moment. And you've also established a website so that you can share these photos with people around the world. So people that are watching at home can actually see these photos. And you've interviewed the colleagues who have taken the photos. And so for a number of the photos, you actually have, like we saw here today, there's audio of the people describing the photo and offering some of this context that you're asking about. So could you talk a little bit about maybe first the website and these audio files and how people can access it, and then maybe we can talk about the exhibition here in the club as well.
Okay, so here you can see the QR code that leads to the website that was created as a part of the web page of Juntendo University. So we are very grateful for this help with this matter. So it basically includes all the photos that are exhibited as panels here at FCCJ, and there is a description that we wanted people to understand that there is always a story behind the photo. There is always a person, there is always a face and a name. It's not just the numbers, it's not just to show how horrible it is. It is always a person who is fighting for his life, or a doctor who is fighting for someone's life. And we interviewed all doctors and medical professionals that provided us with photos to be able to feel what they saw when they see this picture, because doctors, they work with death every day. It's not something unusual for them. They see horrible wounds even after the car accident. But making a photo in hospital by the doctor means that they were shocked enough to stop what they were doing and capture this moment, because it's important to tell the truth in which conditions they are working, how they are fighting, because they fight every day and they're not going to stop. They will fight as much as it is needed. And every time that people close their eyes on the crimes of Russia, when they say that you can't show the violence, but how it's possible to show the war without showing the violence? And this means that by showing the photos and faces of doctors and patients, we wanted to get that respect for their work, for their fight every day. And we believe that it's not enough just to say you support Ukraine and do nothing, or say that you want the photos to be moved or to be covered, because when you say that it's not inappropriate to show the reality in which Ukrainians live, that means that you are silent, and being silent makes you also responsible for Russian crimes, and being silent means you don't really support Ukraine, you're just pretending because that make you feel good from outside. And by making this exhibition, while doing the interviews, as you can hear, it's not, even if it's more than a year after that moment, you can see that the doctor on the video, she is still feel that day. She can't talk for a time because she was remembering the day. She remembered the child and all the feelings that she had then. And I mean, medical professionals are trained to deal with this, but now the way they work, it's not something that can happen in any hospital in peaceful time.
Hello, I'm Bruce Osborne, and I am the head of the exhibition committee. And first of all, I really want to thank everybody involved to have this exhibition here, because it is the most timely, moving, and important message to be sharing at a club like this right now. And I also have to apologize, because without realizing it, this became very controversial yesterday, and there was complaint about the photos being too graphic and too disturbing for people to see on the way to the restaurant. And it was quite shocking and disturbing to find out, because this had never happened before, and this is obviously something that's not been resolved yet, and we will have to deal with this later. And it needs to be clear, because this is a club for news and information to share with the world, and what is the priority is something that we have to get very clear very quickly. But that aside, this show is just moving beyond words for me. I've never seen something so real and so compassionate, and reading the text just brings it more home to me. There's just to see so much heroism and dedication by the doctors and the staff, and not even doctors and staff, but volunteers that are doing whatever they can have. Just shows the power and humanity of being real and trying to do something good in such a devastating, terrible situation. And I just can only pray that this thing will end soon, but I have no hope at this moment that it's going to be so easily resolved. And again, thank you so much for bringing this show to SCCJ. And again, I do apologize, because this is something that I had not expected either, about the changing.
Thank you.
Thank you.
Let me just offer some small context, and then you can speak, so for people that maybe not know what we're talking about. So the exhibition was, you were invited to exhibit here, and there was a discussion at the time about the content of the photos. And on the day of putting up the exhibition, there was some conversation, and we felt we had reached an understanding, and then it became clear that there was an individual that complained about some of the photos and their proximity to the restaurant, and without further discussion and without being notified, the exhibition was completely changed without even your notification or any discussion with you whatsoever. And so we're actually still in the middle of trying to solve this. I can tell you, I'm now speaking as an individual and as a member of the club. I am not speaking for the club. The work that I do is also as I mentioned in my opening remarks, I think that having complaints and having some controversy maybe is a sign that you're doing something right, and this is something that I'm also familiar with. I can tell you, as a member of the press club and as the recipient of the Freedom of the Press Japan Award last year, it concerns me that the exhibition that had been placed in a press club, that a single individual was allowed to alter it without discussion, without debate. And so I think the discussion then becomes no longer what is, I think there's a discussion to be had about what can be displayed, but when that has been decided and the exhibition has gone up, I think it is then a question of what our mission is as the club. And we are not, we are open to the public in as much as members of the public are allowed to come into the club, and we invite them to do so, and we invite them to come and look at this exhibition. But we are first and foremost a press club. We are not a restaurant. That is my opinion, that I hope my colleagues in the press club share. And so I just wanted to offer that context for those viewing at home. But please, if you would like to respond.
Yeah, actually, honestly speaking, I can't imagine reasonable explanations why some of the photos should be removed, because we had the understanding that all the photos were approved, and we didn't include actually horrible ones, because we know what it means to show those, but we wanted to show the faces and the reality. And actually I would like to mention that I really want to meet the person that mentioned that, because I want to hear that saying to my face what are the reasons to move it, because I can't imagine that, and that means that in order for me to try to understand, I need to at least hear what was the reasons to do that. Because, there is war at my home, and every morning that I wake up, I hope I can't read something really horrible about the town, and every time I write to my family, like, are they okay, I hope to see the response as fast as it possible, and I don't like to read the messages from my younger sister telling that I want the life that was before the war. So I don't really understand what makes the person move the photos. And even if it's about the not appropriate place, it's not like I want the person to understand what is war and understand the reality of the war. I don't want anyone to understand that. But at least we expect some understanding of what war is, at least some understanding of what we are doing, and
maybe some respect to these people, because they deserve this respect. These doctors, nurses, and patients, they do really huge work.
It's not just one photo that was moved. The entire exhibition has been changed. To give you a kind of verbal explanation, there's a main hall, which is the exhibition space, on either side of which are meeting rooms and banquet rooms, and at the end of the hall is our restaurant. The hall is kind of L-shaped, and so there's this kind of alcove, and these photos that were objected to were moved into an alcove. They've actually been crowded into the alcove. The alcove was only designed to hold, 5 or 6 pictures, and yet they have been crowded, and they've been layered so that there's more space for those photos. And so I would encourage anyone, please, that is listening to this and is interested, please come to the press club. Please look at the photos, particularly in the alcove. And please know that this is not how the exhibition was designed. And I do hope that we reach some agreement about what to do moving forward, because I can share with you that our speakers are not happy. They continue to be grateful for the opportunity to show these photos, and yet they're not satisfied with the way this has been handled. And I can tell you, as a member of the club, I apologize, and I am also not happy, and I will also work with you and work with the club to reach a decision, because at the end of the day, the focus should be on what is happening in Ukraine. We should not be really focusing on how these photographs are being exhibited in a press club.
Thank you.
We open the floor back up, please.
Yeah, and actually the saying that being apolitical or just that the remarks doesn't include politics, I don't think that actually talks for Ukraine now, because everything that people are doing, it includes politics as well. So when people are just being silent that and doesn't speak against the war and to support Ukraine, that means they somehow support Russia. And when they just not only those who are Russians who have the weapons or who provide the supplies to the front line are responsible, but those who are silent, those who invite them to some sport competitions, those who give them prizes at the cultural events. It's not that it can be said that it's apolitical. It's definitely politics, because it includes Ukraine now. And if you say Ukraine to anyone, the first thing that they have now is a war. That means that every mentioning of Ukraine includes politics.
I would like to open the floor back up to questions. And this includes those of you who are watching at home. Please.
You've spoken about your families back home, but I believe, Oleksandra, you are going back to Ukraine next month.
Yes.
I believe, and you are a final year medical student.
Yes.
And can you just, I think the people here and the people online would like to know what you personally, as a doctor, soon to be doctor, will be doing from now over the next few months and then over the next few years, because I believe you're going back. Of course, you can't fly to Ukraine, so you have to go back on a long route to get back home. And then once you get home, can you explain what you will be doing back in Kyiv and then over the next few years? Thank you.
Thank you. So basically, first of all, I need to pass my exams to graduate from the university, and after that, according to the results of the exam, I'm supposed to choose the place for internship that will last from 1 year to 3 years, depending on what specialty I'm going to choose. So basically, as I want to start learning as a neurosurgeon. That would take another 3 years to learn in the hospital. And the place of hospital actually depends on what I will choose. And so now most of the doctors, they either work at the frontline cities, or they work as military doctors, or they're just volunteer doctors at the front line. But when you're a doctor at the front line or at the frontline city, you need to be as effective and as professional as it is possible, and you couldn't be more trouble to those who are already there. So you need to be trained enough and qualified enough and have enough physical strength, because as we showed you, doctors are at the high risk, and if you can't save yourself, you can't provide any medical help to anyone, and you will require those help. That means you're another trouble for those who are already there. So in order to be the most effective to the patient, I require more training and qualification to provide as efficient medical care as I can. So that is my plan. Thank you.
Wasn't quite clear, but I think you said you wanted to be a brain
A neurosurgeon?
Neurosurgeon.
neurosurgeon.
Yes, neurosurgeon.
Neurosurgeon.
Do you want to explain, you mentioned that the website is being housed on the Juntendo website. Do you want to explain briefly about the Ukrainian team that's here and what you're doing in Japan?
1 year ago, I came to Japan because I got the fellowship from Japan Society for the Promotion of Science. And in 1 month, Juntendo University decided to organize a special program for Ukrainian medical students and doctors and researchers to provide them opportunity to learn in safe conditions, because it was April 2022 and it was the battle for Kyiv, and it was difficult time, and it is still a difficult time, of course. And Juntendo University provided 15 fellowships for students, young doctors, and for medical researchers. And they came in period last summer. For some of them stayed for 3 months for clinical observership. Some of them stayed longer, like 6 months, 9 months, and researchers stays for 1 year. And last summer, we came up with the idea to explain what's going on with Ukrainian healthcare system during the war. And Juntendo University helped us to organize a symposium about Ukrainian healthcare system in the war. And then we started also photo exhibition at the university. It is placed in the first floor of Century Tower of Juntendo University, so you can see these pictures there, but the exhibition is slightly different. We have more pictures there and more description. And when we were organizing this photo exhibition here at FCCJ, Juntendo helped us to make a web page for these pictures, because we have here only 25 panels, 24 panels with pictures, and we have much more photos, and we have stories about every photo. So to show more, we made the material about the exhibition, and Juntendo placed it on the webpage of the university. So if you use the QR code on this slide, you can see and hear more, because there will be audio of doctors who provided these photos, and also stories about people on photos, or about what's going on in this particular area or medical institution.
And I wanted to say that we are really very grateful to the Juntendo University for supporting us. Like everything that we wanted to do and everything that we wanted to learn, they made it possible for us. And they supported us during the symposium and during the exhibition, and every step of preparing an organization. And we really appreciate the whole support and assistance that we get from Juntendo University and Mr. Suzuki, who is sitting here. Thank you very much.
I didn't realize. Hello. So now we have no yeah, good. We'll talk after it's finished. If there is any more questions from the floor, we have time for one more question. Sure.
If you don't mind. You mentioned, I saw in one of the photographs that you are receiving medical supplies from Korea and Japan. Was it propofol from Japan? Are you getting enough medical supplies, and what do you need the most? What medical supplies do you need the most to manage your medical needs in Ukraine?
So basically, there is a list made by Ministry of Health that provide the information about what kind of medications and list of equipment that they require the most. But we also receive a lot of humanitarian aid and help from volunteers all over the world. And taking into account that the volunteer organizations in Ukraine work really hard and a lot, they managed to get the all supplies that are needed for the hospital, depending on their needs. So as for now, I think it is important to mention that it is the help is valuable when it is provided to the place that it is needed. So in case when there is a way that someone wants to help or provide help, there is always particular people who are responsible for that, who know the algorithm and the mechanisms how to make the transaction and logistics the more effective way, how to connect people who need and people who want to provide, and that roads are really fast now in Ukraine, so it can be like one message distance that you connect to those who need, to those who can provide. So in case of Propofol, I'm not really sure how much they have or how much they need it. It was just the remark from the sister of Tetiana. And I feel that in her message she had the enough confidence that she feels the support from people who really support Ukraine, and those medications, and even if it's something not really big, it's always valuable because it means that people support you, actually support. They're not silent, they are doing something. They want to speed up the victory of Ukraine, and also this means that they do understand in what circumstances they are working, they respect their work. And also I want to say that we do appreciate all help that we get from all the countries and from Japan as well, and we know that it's a huge help that Ukraine is actually getting from Japan, and that we use it as efficiently as possible. So as soon as we get some help, there are people who will always use it in the most efficient way and provide to those who need it.
We're reaching the end of our time together. I would like to just thank you again for creating this exhibition and for bringing it here to the press club. And I am just getting a question here, hot off the press. I will read this in its full form. This is from Denis Normil from Science Magazine. This is not a question, but a statement of support for our guests, and to thank them for bringing these photos to the club. I second the comments made by Oleksandra Riabets, Tetiana Yatsenko, Bruce Osborne, and Thomas Ash regarding the rearrangement of the photos. As a member of the club and a former president, I would also like to join Thomas Ash in apologizing to our guests. I saw the exhibit several days ago before the rearrangement, spending an hour or more looking at the photos and reading the captions. I found it moving, horrifying, angering, and inspiring. Yes, inspiring. I left impressed by the resilience of the Ukrainian people and by the courage and resolve of the medical professionals and volunteers who carry on under such challenging conditions.
Thank you. Thank you so much for your comment. It means a lot for us.
I'll give you the last moments here to share anything else that you would like to share, perhaps something that you would like people who are viewing this exhibition to go home with. I will say that I encourage people to please do try to come to the club. It's very different to walk among the photos and to spend time with the photos. Of course, it's a resource that you've placed online, which is invaluable for people all over the world to be able to see, but I do encourage you to look at the actual photos. But perhaps we could end with your hope for what people will take away from this exhibition.
The war is going on, and doctors and other medical specialists in Ukraine, as well as any other Ukrainian people, soldiers, railway system workers, emergency and disaster specialists, everyone works and everyone fights for themselves and for their country. And still we have many problems, and still we need support, and still we have many people in Russian captivity. Actually, we even don't know the real number of people there, somewhere in Donetsk jail or in Mariupol or in Rostov. No one knows how many people are there. But as you can see, doctors don't stop their work. They have enough strength and courage to continue their work, and it gives us hope that we can resist to the end.
Just being silent, that is how the war started. Someone was silent, someone just thought that it's not their business, someone tried to calm down. So as a result, there is a war, a horrible war. And despite this, we are sure that Ukraine is going to win. But it's really easy to come from peace to the war and very hard to return from the war to the peace, because it's always about people. Hospitals can be rebuilt. Yeah, that's a huge amounts of money, but that can be rebuilt. But people who were injured, who were killed, it's something that we can't return. And every minute and every hour, someone dies in Ukraine just because someone is silent or want to calm down or doesn't think that their business, or they just don't think they can do something. But actually, everyone can do something, at least in their field, at least what they can spread the truth. They can support Ukraine by talking the truth and not closing their eyes on the Russian crimes.
We have now been charged with knowing the truth and to speaking the truth, and let us be inspired by these words. Please join me in thanking our guests, Tetiana Yatsenko and Oleksandra Riabets, and all of their medical professional colleagues and doctors for sharing with us this very painful truth that we are now charged with facing. Thank you.
Thank you.
Thank you.